I'm here today with Susan Matney, who's a graduate of our program. And Susan, would you introduce yourself and tell us a little bit about your education and your career?
I am Susan. Maiden name is Story. I went to school in Montrose, high school in Montrose and Olathe. Married name is Matney. I married Fred Matney in 1978. I started as a nurse's aide at Montrose Hospital when I was in high school, and I knew I always wanted to be a nurse. And I actually tried to join the Army to become a nurse, and I was 2 pounds over the weight. So nurse friends at Montrose Hospital encouraged me to apply to Delta Montrose Votech and to the LPN program. And I did. I applied to the LPN program and got in. And my instructors were Claudia Reel and Sherry Barclay were my instructors at that time, and I will forever love Claudia Reel. Both of them were really awesome. And then I got my LPN, and I worked 8 years and had 3 babies. And then I decided I wanted to be an RN, and so I went to Grand Junction and got my associate's degree at Mesa State College. It's got a different name now. And so right after I graduated, we moved to Moab, and 6 months after graduating, Moab had a change of management, and they let the director of nursing go, and we had a meeting with the nurses, and I led this discussion with the nurses, and they came back to me and asked me if I'd be the director of nursing. And so 6 months after graduating with my associate's degree, I was the director of nursing at Allen Memorial Hospital in Moab. And that was in 1989. And while I was there, I commuted back and forth up to Salt Lake, and I got my bachelor's degree from the University of Phoenix when it was an accredited hospital, accredited school. And University of Phoenix isn't accredited for nursing anymore. And then we wanted to move up to somewhere for Fred to go to school. And so we moved up to Bountiful, Utah, where I took the job as the director of women's services. I had worked in women's services for a lot of years. And so I was over labor and delivery, female surgery, and the nursery. And I did that for 5 years. And they also put me over order entry. And that was my really first exposure to computers, second exposure. In Moab, I created a wholesale to average retail price for the billers to be able to bill, and I did that in Lotus Notes. But my first really getting into informatics and seeing what it was when I was working at Lakeview Hospital. They sent me to HCA's corporate offices, and I did some training in Nashville for Healthcare Corporations of America and learned order entry. And so I decided I wanted to get my master's degree, and the nursing informatics program had just started at the University of Utah in 1993. And so I started the program in 1994, and I graduated in 1997 with my master's degree in nursing informatics. And so at that time, then I went to work for Intermountain Healthcare, and I worked as an informaticist. And an informaticist, nurse informaticist, talks nurse speak and talks computer speak, and can help the two to talk to each other. If you're developing software, you want to have nurse input. The programmers have no idea what I asked a program. I said, I need in my units of measure, I need fingers. And he says, why do you need fingers? And I says, because I want to say that the fundus is 2 fingers above the umbilicus. He says, oh, you can't do that. You can't have fingers as a unit of measure. And I said, yeah, yes, you can. So I became very involved in the standards organizations when it comes to sharing medical data. And not just like ICD-10 and for billing or CPT. It's the actual point of care measures, like your laboratory measures, nursing assessment measures, all your medications, all of your body or systems, all the diseases, all of those have standardized terminologies that are used within healthcare. Some that nurses are familiar with are like NANDA, the North American Nursing Diagnosis Association, where you have nursing diagnoses. And those are integrated now in SNOMED. There's 2 mandated terminologies in the United States for use within the electronic health record for clinical documentation. That is SNOMED for problems and body locations, and then LOINC, which is logical observations, identifiers, names, and codes, which is laboratory measurements and other measures. I got really exposed when I was sent to a nursing terminology summit. And my boss sent me to a terminology summit where all of the terminology developers were, and I found out that LOINC and SNOMED, neither one of them had been submitted to the American Nurses Association as a terminology for use for nursing and electronic health records. So I started in 2002 the Nursing LOINC Subcommittee and took LOINC to the American Nurses Association and got it recognized as a terminology for use within the electronic health record. And LOINC includes all of the laboratory measurements, and we discovered that it also is useful for physiologic measurements. So over time, and the Nursing LOINC Subcommittee, I have led teams. It's not all work by me, it's led teams, and we have completely standardized the basic head-to-toe physiologic assessment within LOINC, which would have the breath count, your last BM date time, skin color, eye color, just basic things that you have normal question and answer pairs, and I've standardized those for use across the industry. The Nursing Informatics Scope and Standards was revised in the early 2000s, and they said that nursing informatics supports the development of data, information, knowledge, and wisdom. And that's the kind of the definition of it. They say, well, data is 62. That means nothing unless I tell you a respiratory rate is 62 or a heart rate is 62. Then you know that you have name value pairs, and that is information. And so once you get that information and you put it all together and use critical thinking, that's knowledge. Because you look at me, my age is 62, I'm alert, I'm pink, I'm speaking, making sense. And so you can make a diagnosis that I'm okay from that knowledge. But I had no idea what wisdom was. I wish I had slides. We should do this again. I can bring you slides. So I decided I was going to go back and do a dissertation. And I did the first dissertation coming out of the College of Nursing at the University of Utah. I created a theory of wisdom in action for clinical nursing. And I defined wisdom for nursing. And I did that by using other theories. The main base theory came from psychology. There's 2 kinds of wisdom. There's general wisdom, which is interacting with others, and then there's personal wisdom, which is inner wisdom about me. And nurses need to use both. And what came out from the theory was the technical pieces. That was really strong. And the nursing process is very, very technical. You have to have critical thinking. But then I interviewed emergency room nurses, and I collected 30 stories, and I pushed that against did a big concept analysis with wisdom and those stories. And what fell out from those stories was the affective parts. A really wise nurse has emotional intelligence. They're able to understand your emotions, able to understand my emotions, and can deal with them with empathy. So not only is wise nurses technically proficient, they're also very good at emotional intelligence, collaboration, assertiveness, all of those characteristics. And the other thing that fell out from the interviews that I didn't have in the initial theory was insight and intuition. There's a lot of times a nurse does things just because they have a gut reaction. So I completed the theory. There's 3 publications. If you want to look for Susan Matney and read about wisdom and nursing, you'll find my theory information. In 2015, I graduated, and it is now adopted and included in the nursing informatics scope and standards as an emerging theory, which is way cool. So I've received a lot of accolades in the industry. The American Medical Informatics Association gives an award to a nurse every year, and I received that in 2018 for the work that I've done in standards. The University of Utah selects a distinguished alumni, one every year, and I received that also in 2018. So many fellowships because of what I've done for the industry and the publications that I've done. I've always believed that you need to publish it to get it out there so nurses can understand it and use it. And so I'm a fellow in the American Academy of Nursing and a fellow in Health Level 7, which is a messaging standard for how you send the data, a fellow in the American College of Medical Informatics, and a couple others. So I have had a very interesting career. And when I was at the Delta Montrose Votech, I had a big piece of plastic that I put behind that showed the margins, and I rolled it in my typewriter behind my paper so I could see the margins. And then I had my whiteout that if I whited things out, I had no clue where my career was going to go in the 40 years plus that I've been a nurse. You know, I'm still certified in labor and delivery. I keep that certification. I've done some work with ACOG, which has been fun, American College of Obstetrics and Gynecology, standardizing some of their instruments for them. But I feel like foundationally, I received a really good starting foundation from the College of Nursing, and you don't know what you don't know. I mean, from the Votech, and as you expand your knowledge, you realize you're expanding what you already learned as foundational, and that was what I got as an LPN at the Votech.
Great. Wow, I'm really impressed with your career. That's great that you've gone on to become a pioneer and a leader in the area of nursing informatics. Is there anything else you'd like to say before I stop the recorder?
I'm a true believer in nursing. I really and I'm also a true believer in having good data, and it needs to be standardized and it needs to be interoperable. And if you're ever selecting computer health systems, please ask about the terminologies that are used on the back end. Make sure that you're using the ones that can be shared. My mother and my husband have both been very ill, and I've seen how data is not shareable between settings. I've also seen wise and not wise nurses. And so make sure your data is coded and that you're interoperable, but also make sure that you touch your patients and that when you care for them, you're using your emotional and your senses. And please be a nurse. It's the best profession in the world. And that we are the ones that can affect patients and their families and their caregivers emotionally in ways that clinicians, doctors cannot. Nurses are caring and doctors are curing. So thank you for being a nurse.